Hey y'all, I had some people asking me questions about units on a syringe from my Tox video because I was trying to explain it to y'all in layman's terms because some of these videos are so confusing. Y'all, you're going to use a 5 ml diabetic syringe, okay? It's just a disposable insulin syringe. You get them on Amazon. You get a box of them for like 12 bucks, okay? I order them on Amazon. But this, I want you to save this photo because this right here, this last little syringe is the 5 ml syringe. And y'all, basically, 2 units of tox is 0.5, okay? So that's gonna look like this. This is 2 units of tox, right here, 0.5. Okay, 4 units of tox is gonna be 0.1, which is right here, which is gonna look like this. Okay, 6 units of tox is 1.5, which is gonna look like this, okay? And then 8 units of tox is 0.2, which is gonna look like this, okay? Now, most people are going to have between 2 and 6 units of tox per injection. Now, I will tell y'all, everybody is different. Everybody's face is different depending on how long you've had tox, how much tox you use. If you know how much you're gonna use or how much you've had in the past, if you've had tox in the past, if you know that, that's very helpful. What I like to do, and there's a couple of reasons to do this. These insulin syringes, if you know, like I know for a fact that I need 4 units in each spot that I do up here, okay? I know that, I already know that about myself. 2 is not enough, 6 is too much, 4 is just right. So what I'll do is I'll go ahead and I will go ahead and draw up my injection points on individual syringes, okay? So each individual's, I'll get a syringe for here, a syringe for here, a syringe for here, and I go ahead and I pre-draw it up. That way I know exactly how much tox I am placing in what location. Some people will draw up a whole freaking syringe of tox like this, and they'll just do a little at a time. I don't like to do that because I don't know, I can't control it. Like I'm trying to pay attention to the injection. I always do it in a magnifying mirror because I want to see the little whelps come up, right? I want to see how big they are. I want to see where they're going. You got to be really careful when you're doing this. You don't want to accidentally put too much here and not enough here, and then this side doesn't have as much as this side, and then you end up lopsided. That can happen. So you've got to be really careful with when you're doing this. It's so much easier to just pre-fill the syringes, okay? You get a whole box of these damn things for like 12 bucks. If you're going to spend the money on the tox, you're going to save a lot of money there. So just go ahead and waste the syringes, okay? Do a syringe for each injection point. For 1, it's sanitary. For 2, it keeps the needle sharp. And for 3, you know exactly what you're putting and where you're putting it. That's what I do. You do what you will, but to me, that's the easiest way. Now, I will go ahead and I will do I'll try to do a marking video for y'all so you can see how I mark my face. Now listen, everybody's gonna be different. I will try to explain it in layman's terms the best I can. But if y'all have questions, like there's some videos and some other people on here on this site that I've seen some of their videos that I feel like they do a really good job of explaining things. One lady that is really good to watch that I like, her name, it's Oceanside Clinic or Ocean Breeze Clinic, something like that. She's real cute. She's got blonde hair. She's in Florida. So I don't know her name, but she does she is a licensed professional and she does a really good job of explaining it in layman's terms, which I like because some of these people on here are way too confusing. And if you're just going down the rabbit hole and you're trying to learn, you don't want to practice on yourself and screw yourself up. So just, send me messages if you have questions, okay? But save this for reference because this is really helpful.